Struggling with high cholesterol? Learn how Vytorin, Ezetimibe/Simvastatin, works, what to expect, and if it's the right choice for you, all in one quick video. What is Vytorin, Ezetimibe/Simvastatin? Vytorin, Ezetimibe/Simvastatin, is a prescription medication that combines two cholesterol-lowering agents to target high cholesterol through dual mechanisms. This combination works by both reducing the cholesterol your body absorbs and limiting the amount it produces. Vytorin is used to lower LDL, bad cholesterol, and triglycerides while helping to raise HDL, good cholesterol. It plays a critical role in reducing the risk of serious cardiovascular events, such as heart attacks and strokes. However, it should be taken alongside a heart-healthy diet and regular exercise for optimal results. What is Vytorin, Ezetimibe/Simvastatin, used for? Primary hypercholesterolemia, high cholesterol. Homozygous familial hypercholesterolemia, HoFH, a rare genetic disorder that causes very high cholesterol levels. How does Vytorin, Ezetimibe/Simvastatin, work? Vytorin, Ezetimibe/Simvastatin, combines two active ingredients with complementary actions. Ezetimibe, a cholesterol absorption inhibitor. It works by limiting how much cholesterol is absorbed from food in your digestive tract. Simvastatin, a statin. It lowers cholesterol by blocking HMG-CoA reductase, an enzyme in the liver that plays a key role in cholesterol production. Together, these components help improve cholesterol levels more effectively than either medication alone. Vytorin, Ezetimibe/Simvastatin, dosage forms and typical costs. Vytorin is available in tablet form and comes in multiple strengths. Below are average prices with a GoodRx coupon applied. Strength, quantity, approximate cost, price per tablet, 10 milligrams per 10 milligrams, 30 tablets, $351.94, $11.73, 10 milligrams per 20 milligrams, 90 tablets, $1,215.64, $13.51, 10 milligrams per 40 milligrams, 90 tablets, $1,215.16, $13.50, 10 milligrams per 80 milligrams, 50 tablets, $684.12, $13.68. Typical dosing for Vytorin, Ezetimibe/Simvastatin. The standard dose ranges from 10 milligrams per 10 milligrams to 10 milligrams per 40 milligrams, taken once daily in the evening. The exact dosage may vary based on individual medical conditions, especially for those with kidney issues or those taking medications that interact with Vytorin. Always follow your healthcare provider's instructions when using this medication. What are the side effects of Vytorin, Ezetimibe/Simvastatin? Like all medications, Vytorin, Ezetimibe/Simvastatin, may cause side effects. Most are mild and may improve as your body adjusts to the medication. However, it's important to report any persistent or worsening symptoms to your healthcare provider. Common side effects. These side effects were reported in clinical trials and typically occur in a small percentage of users. Headache, 6%. Muscle pain or discomfort, 4%. Upper respiratory symptoms, such as runny nose, cough, or sore throat, 4%. Diarrhea, 3%. Other reported side effects. Some people taking Vytorin may also experience general fatigue or tiredness, discomfort or pain in the arms, hands, legs, or feet, skin rash or other changes to the skin. Serious side effects. Although rare, Vytorin, Ezetimibe/Simvastatin, may cause serious health concerns. If you notice any of the following, seek medical attention immediately. Muscle breakdown. Rhabdomyolysis symptoms may include muscle weakness, intense or unexplained muscle pain, fever, fatigue, and dark-colored urine. Liver damage. Be alert for signs such as yellowing of the skin or eyes, jaundice, dark or brown urine, light-colored stools, persistent nausea or vomiting, abdominal swelling, or confusion. Always speak with your doctor or pharmacist about any symptoms you experience while taking Vytorin. Monitoring your liver function and muscle enzymes through routine blood tests is often recommended to ensure safety during long-term use. Pharmacist tips for taking Vytorin, Ezetimibe/Simvastatin. To get the most benefit from Vytorin, Ezetimibe/Simvastatin, it's essential to take it exactly as directed. Here are expert tips from pharmacists to help you take this medication safely and effectively. 1. Take Vytorin in the evening. Vytorin is most effective when taken at night. This is because simvastatin, one of its active ingredients, has a short duration of action, and your body produces a majority of its cholesterol while you sleep. Taking it during the day may reduce its cholesterol-lowering effectiveness. 2. Take with or without food, but always swallow whole. You can take Vytorin with or without meals. However, the tablet must be swallowed whole. Do not cut, crush, or chew it, as this can affect how the medication is absorbed and how well it works. 3. Limit alcohol intake. Drinking alcohol while taking Vytorin can increase the risk of liver damage. To protect your liver, avoid excessive alcohol consumption throughout your treatment. 4. Watch for drug interactions. Vytorin can interact with many commonly prescribed medications, including warfarin, Coumadin, amlodipine, Norvasc, colchicine, Calcrease. Before starting Vytorin, inform your healthcare provider about all prescription medications, over-the-counter drugs, and supplements you're taking. Your provider may need to adjust doses or choose alternative treatments to avoid interactions. 5. Time it right with bile acid sequestrants. If you're also taking a bile acid sequestrant, such as cholestyramine prevolite or cosevalum Welchol, take Vytorin at least 2 hours before or 4 hours after. Taking them too close together can prevent your body from fully absorbing Vytorin, reducing its effectiveness. 6. Avoid grapefruit. Grapefruit and grapefruit juice can raise the levels of simvastatin in your blood, increasing the risk of side effects. Avoid all forms of grapefruit during treatment. 7. Support your treatment with diet and exercise. Vytorin works best as part of a comprehensive lifestyle plan. Stick to a low-fat, heart-healthy diet and maintain a regular exercise routine. These habits work alongside the medication to help lower cholesterol and reduce cardiovascular risk. 8. Not safe during pregnancy or breastfeeding. Vytorin should not be used if you're pregnant or breastfeeding. If you're planning to become pregnant, speak with your provider in advance. There are safer options available to manage cholesterol levels during pregnancy. 9. Keep up with regular lab monitoring. Your provider will monitor your cholesterol levels and liver function with blood tests while you're on Vytorin. Make sure to attend all scheduled appointments so your provider can adjust your dose if necessary and ensure the medication remains safe and effective. Frequently asked questions about Vytorin. Ezetimibe/Simvastatin. Why do I need to take Vytorin? Ezetimibe/Simvastatin. At night, Vytorin contains simvastatin, a short-acting statin. This means it doesn't stay in your system all day. Since your body naturally produces more cholesterol at night, taking Vytorin in the evening helps it work more effectively. However, if nighttime dosing is difficult, speak with your provider. It's more important to take Vytorin consistently than to miss doses entirely. Is Vytorin 10 milligrams per 80 milligrams a safe dose to take? For most people, the maximum recommended dose of Vytorin is 10 milligrams per 40 milligrams per day. In 2011, the FDA advised against using more than 40 milligrams of simvastatin daily due to a significantly higher risk of serious muscle damage. The 80 milligrams dose may be considered only for patients who have been taking it for over a year without muscle-related side effects. If you are currently on Vytorin 10 milligrams per 80 milligrams, consult your provider if you notice muscle pain or weakness. What's the difference between Vytorin and Rozit? Both Vytorin, Ezetimibe/Simvastatin, and Rozit, Ezetimibe/Rosuvastatin. Combine ezetimibe with a statin, but the difference lies in the statin's strength. Simvastatin in Vytorin is considered low to moderate intensity. Rosuvastatin in Rozit is moderate to high intensity. Your provider will choose the most appropriate combination based on your LDL levels and overall cardiovascular risk. What can I do if I experience muscle pain from Vytorin? Muscle pain can occur with simvastatin, especially when starting treatment. For many, the discomfort is temporary and resolves within 1 to 2 weeks. If the pain is persistent or severe, talk to your provider. Options may include reducing the dose, taking the medication every other day, switching to another statin or cholesterol-lowering therapy. Seek immediate medical care if muscle pain is accompanied by fever or dark urine, as these may be signs of rhabdomyolysis, a serious condition involving muscle breakdown. Can I take Vytorin, Ezetimibe/Simvastatin, if I'm pregnant or breastfeeding? No, Vytorin should not be used during pregnancy or breastfeeding. Statins are not recommended for pregnant individuals due to potential risks, and Vytorin has not been well studied in breastfeeding. There's a possibility that the medication could pass into breast milk and harm the infant. If you're pregnant, planning to become pregnant, or nursing, discuss safer alternatives with your healthcare provider. Want more trusted health insights like this? Subscribe to HeInfo, your reliable source for clear, doctor-reviewed information about medications, conditions, and health tips. Don't forget to like, share, and turn on notifications for our latest updates.